Treatments for cancer. There are a vast array of treatments for cancer. We've everything from, your broad stroke, Eastern medicine versus Western medicine, different cultures. There's far too many to talk about. One such method is chemotherapy for a very specific set of cancers, a very specific pathway that your healthcare provider might want to put you on. So firstly, what is chemotherapy? What is the general spectrum of what chemotherapy is? Is there a general cancer that it would be relatively consistently prescribed for? Can you tell us about chemotherapy, broad spectrum?
Well, chemotherapy falls under systemic treatments. So chemotherapy can be given in a whole number of different ways. It can be given in a tablet form, in a cream form, in an injection form, and even into your vein as well. And in fact, there are even more ways of administering chemotherapy. But chemotherapy is a set of drugs which are classified as being cytotoxic, big word, meaning poisonous to cells.
All cells?
Doesn't discriminate. Poisonous to cells, and particularly cells which are growing quickly. Chemotherapy is prescribed to many different types of tumors. And in fact, chemotherapy, interestingly enough, is also prescribed for non-cancers.
Never knew that, yeah.
For prescribing chemotherapy, and that's not for a cancer. So rheumatoid arthritis, one of the treatments is a chemotherapy. So chemotherapy comes in a variety of drugs and a variety of dosages, and not all chemotherapies are equally poisonous. Some are less so, some have less side effects, etc. But I think the one message I'd like to get across is that the importance that we are not casual with chemotherapy, because chemotherapy can be dangerous. And it can be dangerous, not just the person that is taking it, it can be dangerous to other people as well through absorption by contamination. Meaning, if I've dropped my chemotherapy tablets on the table over here and my child comes and plays a game of Scrabble over here, there is a possibility of a contamination via that method.
If we can, why don't we let's start with the efficacy of taking the drug. There have been many studies that have been published and done both by independent institutions and pharmaceutical companies and everyone who's done studies. Cancer is obviously a massive industry globally. A lot of the studies talk about the efficiency and efficacy of a treatment based on medication compliance. So how well you take the medication that you have been prescribed by your healthcare team. Can we start there? What's that importance?
Well, just perhaps to break down some of those words you've used there, because you used some big words. How well the medication works and the importance of taking the medication as prescribed because you're wanting it to work as best as possible.
Sure.
And so to try and keep to that prescription is really important. So if the prescription is you need to take this tablet twice a day, as far as possible, you need to take it twice a day, and you need to try and take it at the same times each day.
And that's not just because, that has been clinically proven. That's
scientific.
It's the treatment. Yeah, you are more likely to have a better outcome in your treatment pathway if you follow that treatment pathway as closely as possible, as opposed to, I'm going to play this on feel.
Absolutely. Yeah, no, that's absolutely true. And let's be honest, sometimes things happen beyond your control. So let's say you were feeling particularly nauseous and you've taken your treatments exactly as you're supposed to, but in spite of that, you have actually vomited and you have possibly lost a dose. Maybe you have, maybe you haven't, maybe you've absorbed that, maybe you haven't. So then what do you do?
So it's not actually, I was even thinking like inside of your control, I need to set an alarm on my phone so that I can take it. But you just sometimes
you might just forget, you might just absolutely just forget. But sometimes something else has happened that you've taken the tablet and it's popped out, of course. Really bad diarrhea. There's another example. You're taking your medications and yet they're just charged right the way through your system, and how much of that treatment was actually absorbed into your system.
Okay. Tips and tricks for ensuring that you stay on, as accurate as you can? Reminders on your phone, setting alarm, making sure that whoever it is that's helping you through your care team is on it, knows exactly what you're taking.
Caregivers assisting you, absolutely. So I think starting with if you have missed a dose or if you have taken the dose but you have really severe diarrhea or you have vomited, don't take another dose because you don't know if now this is double dosing or not. That's a real issue. The importance of actually managing those side effects, by the way, is huge as well. So take the anti-nausea treatment, and if you don't have anti-nausea treatment,
speak to your healthcare team.
Speak to your healthcare team, absolutely.
Look, I think speak to your healthcare team anyway, because knowing what you need to do. But you'd mentioned that doubling up on dose is maybe slightly more dangerous. Is that the general rule of thumb, is rather miss a dose than double up if you're unsure? Obviously, that's not a hard and fast rule, but that's a general principle that can guide us.
Again, if you have noticed that you've missed a dose or you're pretty sure that you've lost a dose through whatever reason, good idea to phone your doctor, your healthcare providers, to say, look, this has happened, what do I do? But most often they would probably advise you leave that dose alone, continue with your normal doses as you normally would if you had have taken things routinely. Okay. So don't change.
So taking it as scheduled is incredibly important. What about actually taking it? Peripheral neuropathy. There are a lot of different things. Nausea that you've mentioned now, something as simple as not being able to touch the blister pack to take the chemotherapy out because you're suffering from side effect. What about the focus in there as well? Because that would be incredibly difficult, knowing what the medication looks like, not just the outside of the box, but the inside, because I need to know what pill I'm taking at what time. I might have a nausea tablet and a chemotherapy tablet and a something else tablet, and when the three are on the table and I'm looking at them,
they all look exactly the same, all look similar. Yeah, absolutely. A simple example is medications kept in a bottle, and those bottles with those safety caps that you have to push down and screw. Yes. People have trouble with that, and they can't always open the bottle. So how do you access your treatment in the first place is what you're mentioning. Yes. And again, the blister packs, trying to push those tablets out when your fingertips are on fire and it's too painful to touch that. So you do need to be able to access the treatment in the first place, and you might need to get a caregiver to assist you with being able to get those tablets out. Yes. At that point, I've just thought that if your caregiver happens to be pregnant, it's really important that a pregnant person does not handle your chemotherapy. Yeah. That would be dangerous for them because you can absorb the chemotherapy through your skin.
Look, we'll touch on the safety just now because I think that's also an incredibly large topic that we'll talk through. A little bit more about taking the drugs themselves. So I have been put on a treatment pathway. I need to make sure that I'm following it, making sure that I'm having this conversation with my healthcare team when I'm with my doctor, when I'm with my pharmacist, to be able to understand exactly what I'm taking, when I'm taking it, because it's intricate. It's not just, I take this in the morning. Maybe that's what you're on. Maybe you just have one tablet a day and you need to take it with breakfast, and that might be easy, but you might not be in that position. So would you recommend pen and paper, phone, because technology is a thing, and specifically asking your doctor, can you please show me which one is which, knowing the dose, knowing when to take it? Absolutely. Can you give me an example of the exact time that you would recommend I take it, so that you're not just getting the prescription paper, I take it to my pharmacist, they give me a whole big bag of pills, I go home with my bag of pills, yes, and now I've got like 8 boxes that I...
It's so confusing. So we just randomly chat. I cannot overemphasize the importance of taking your medications as correctly as you possibly humanly can. Mm. So the importance of sitting down with that healthcare provider, and it might be a doctor, it might be your nurse, it might be the pharmacist, to sit down and say, right, there's a prescription, help me understand it. Let me understand the name of each drug, what it looks like, perhaps the side effects of those medications. It would be nice to know that. Mm. When I should take it, what do I do if I miss a dose, when to take the dose, how to take the dose, as close to the correct timing as possible.
So being proactive, massively important, because I don't just want to wait until I'm at home with all the boxes. I want to know the information before so that you can be as effective as possible in your treatment plan, as safe as possible in your treatment plan for both you and your family.
Well, also remember that this is a very stressful situation. So you're given all of these medications and you're trying to focus on exactly what your healthcare provider has told you and how to store them, how to take them, etc. But it's an overwhelming situation. So again, using little tips like writing down things or asking your healthcare provider to write things down for you, putting...
Or your caregiver. You've got a family member support structure that goes into the appointment with you.
Yeah.
I'm not going to be able to ask, please don't forget to ask about my cancer, and they can take the notes for you.
And very important to remember, of course, that prescriptions change. So the first time my doctor said I must take 2 of these tablets, but now, in fact, a month later, the doctor said, no, in fact, only take 1. You need to adjust your notes.
Yes.
Or if you're written on the label on the actual box, you need to remember to change it. So a very, very important tip is take all your medications with you every time you go to the doctor to say, this is what I'm taking. Is this still correct?
That's a great tip.
It's really important. Yeah, it's really important.
I think it's an important point to bring up at this moment as we change between is that finally she has given us a word. And it's a good word as well. My goodness, well done. 8, 9, 13. Good job, 26. So with that very important change, now that you've finally given me something, we can move on to the safety of taking these drugs. We've mentioned it a few times already. It's not just about the efficacy of taking it. Again, studies have shown take it when and as often as prescribed. But it's not just the safety of the individual taking it that's important. You also need to be incredibly aware of those around you, those handling the tablets, those handling the needles, injections, those handling you and your body fluids, or maybe coming into contact with them at a later point. That's also hugely important.
So take home message, don't be casual with chemotherapy. Yeah. Chemotherapy is dangerous, and it needs to be treated with the right amount of respect and care and caution. So where do we start? We start with keeping the chemotherapy drugs in their original packaging. One, because it identifies what they are, but it also keeps them safe. It keeps them secluded. We don't want to be keeping our chemotherapy drugs next to the food that we're going to eat or the food that my children are going to eat because of a potential contamination. So it's really important to be aware that this is chemotherapy. If I'm able to take out the medications myself and I've used my hands, wash your hands afterwards, because if you don't wash your hands, you might have trace elements of the drug on your fingertips, and then you touch things and you may contaminate surfaces and people.
We went to a conference once where that was brought up.
Quite accurately.
It was a fabulous demonstration of...
Because it's not just about me touching your hand, or for example, I'm handling our chemotherapy and then I'm touching your hand, or the child comes and touches the box. The example was brilliant.
The example was the pharmacist who was giving the lecture put some specific powder onto a hand that we weren't aware of before this whole...
You couldn't see the powder under natural light, yeah. It was...
And she welcomed us, we chatted, scratched, head, played with your hair, etc., wrote with pens. And after all of this had happened, she then brought the ultraviolet lights out. And you could see just from something that was initially just on her hands and how it had spread throughout that audience, throughout that lecture room. It was actually quite terrifying, actually. Yeah. And the point was very, very clear. Don't be casual with chemotherapy. If you have touched the drug, wash your hands. If you are the caregiver helping getting the medication out for your patient or your loved one, preferably don't touch the drug, put gloves on or move it into a container, but then remember the container has a contamination in it. Wash your hands, always. That's such an important rule, just for basic hygiene. But in terms of the conversation today, being casual with chemotherapy.
Because bringing that into the home environment.
I don't want my children to be exposed to my chemotherapy.
Well, it's not, yeah, so you don't want your children exposed to it, but you take it, you've touched it, you don't wash your hands. Your child has just played with their toys, left a mess everywhere. I've got a toddler, I know. You walk into the room, you pick up all their toys, you put them in the box because the child's gone to sleep, no worries. All of their toys are now covered in what was on your hands. They wake up the next morning, probably at 3 o'clock in the morning, if it's anything to judge by my life at the moment. We go through, we sit on the playmat, we play with our toys, we're playing with all the nice animals, and now their bare hands are touching whatever was on your hands from the night before. Even though you've showered since then, you've washed I didn't want to touch it now that I'm sitting with my child. But it's that interim in between. Take it, wash your hands immediately.
A far more common example of how we can be exposed to chemotherapy inadvertently or without realizing it is, let's say, for example, I've just been to my clinic, I've had my chemotherapy infusion, I come back home and I go to the bathroom and I pass urine in the toilet. And there might be a few little splashes on the toilet seat.
Well, probably not for you.
Probably not for me, probably a bad example, perhaps, yeah. But the idea is we excrete chemotherapy in trace amounts for up to 48 hours often after we've had the chemotherapy. So you need to be thinking about toilet seats, about wash basins, about taps that you're touching, etc.
Coughing into your hand, saliva?
Possibly, yes. It'll be trace amounts. It'll be trace amounts, but something to be aware of. And then, of course, if you're taking tablets at home every single day, that's a continuous thing. And then you're not just talking about 48 hours after your treatment because you're taking treatment every single day. So it's an awareness about keeping yourself safe, most certainly, but you're wanting to keep those around you safe as well. Yes. So again, the take-home message, don't be casual with chemotherapy. It must be stored safely. It must be kept out of reach of children, out of reach of pets, etc. It should be taken correctly. The way it is designed to be taken as prescribed is really, really important.
So very importantly, I've been extra careful in home while I've been taking it. I've been extra careful with everything that I've been doing. I've now finished the specific prescription that I'm on. I need to go and replace it. I've got my box that has been sitting, or the little container with the weekdays on it and what I need to be. How do I manage those? I'm assuming I don't just drop them in the dishwasher.
So this is cardboard, for example. So
Probably bad to drop it in the dishwasher.
it probably won't work so well in the dishwasher, no. But anything that chemotherapy has touched has been contaminated. So we don't want to just take those empty chemotherapy boxes or blister packs and whatnot and throw them into the dustbin, because then they end up on a waste dump somewhere and you're going to contaminate somebody working there, for example. So again, don't be casual with chemotherapy. You really need to take all of your discarded or the empty containers, put them in some sort of a packaging that is waterproof, preferably. I suppose you could put it into a packet that is tightly sealed, and take it through to your pharmacist, or even better, take it through to your treating team. Often the pharmacists are there, and ask them to dispose of it, because they've got the correct medical waste to be able to do it. So please don't just take those empty containers and say, well, it's finished now, and turf it.
Yeah,
because that is dangerous for somebody else.
Sure.
So it goes back to that very important point or tip that you had made earlier, which was take your medication into your doctor's appointment every time you go, whether that be the empty box that you're taking to throw away, they can discard it for you, or you're taking it in because they can update you on what pills you need to take more often. You update your notes, and you take them all out and you say, with gloves on or however they would want to handle it, okay, doctor, which one are we dealing with now? How do you want me to adjust it? One of the big tips,
it's that important.
Take it in every time, whether it be to throw away or to update.
It's that important. Your medication is important. It really is. And you need to really treat it with the utmost respect and care.